Hello, I'm Matthew Weinstock with Hospitals and Health Networks, reporting to you from the Health Forum American Hospital Association Leadership Summit in San Francisco. Earlier this week, the AHA honored Henry Ford Health System and Robert Wood Johnson University Hospital with its second annual Equity of Care Award. This award recognizes hospitals and health systems that are making really significant strides to not only reduce healthcare disparities in their communities, but also improve diversity in their leadership ranks. And right now, I'm pleased to be joined by Nancy Schlichting, CEO of Henry Ford Health System, and Stephen Jones, who's the president and CEO of Robert Wood Johnson University Hospital. Nancy and Stephen, thanks for being with me today.
Great to be here.
Glad to be with you.
So first, what does an award like this, what does a recognition like this really mean to your organizations and the people who are doing the work on the front lines?
Well, I think it empowers our people. There's nothing better than some recognition, I think, to really affirm what they're doing. And so we're very honored, and it's just really a great privilege to be here with Stephen and to share ideas on how we can continue on this very important equity journey.
It's a wonderful achievement. Robert Wood Johnson University Hospital has a proud history of serving the community. And about 4 years ago, we began a journey inside the hospital on diversity and inclusion. And this is a great recognition for a lot of people that did many things that have transformed our organization in a mere 4 years. And we're really excited and proud of that.
So we're going to talk a little bit about what you've done organizationally and internally to foster some of this, but I want to start talking about what you're doing with data, because both of you are doing a lot with data to target specific populations. Talk about what you're doing a little bit and how you can build on that and what it means moving forward in an era of population health and value-based reimbursement and the transformation we're undergoing.
Well, one of the things we decided very quickly was we didn't have good data. So we began collecting race, ethnicity, and language data on our patients. And we asked them to self-identify how we should really look at them and make sure we understand their needs. So now we collect about 80%, on 80% of our patients, we are able to get that information. And it's allowing us now to really look at differences in outcomes between groups of patients that we care for. So it was a very important part of our strategy.
As we started asking questions about patients' perceptions of the care they got at Robert Wood Johnson University Hospital, we clearly recognized that it was hard to segment them. We didn't ask the same questions at the front end for inpatient care, through the ambulatory care process, in our physician-owned practices. So we weren't able to add and to compare that data. We have a lean project going right now to help us with improving how we collect that data. Once you have it, we've already taken action, but we've got to improve how we collect it.
And I know for you guys, it's resulted, right, in reduced readmissions for CHF patients, better care for some diabetic patients. Can you expand a little bit on how it is impacting patients at the core?
Sure. At Robert Wood Johnson University Hospital, in analyzing why patients got readmitted, we found patients that they got sick again before they went to their primary care doctor. They got sick again before they got their medication. So one of our projects using the DSRIP initiative was to set up a program, an initiative where we could be a bridge to getting them to their primary care doctor or their federally qualified health center. And so we set up a DSRIP clinic that will see patients, that will meet some of their social needs, helping them get medications at the appropriate price, and make sure we can keep them healthy during that bridge. It's not a long-term continuity clinic, but we want to get them to their long-term solution. And this was really effective.
I think we've understood very clearly with the information we have that socioeconomic issues are at the core of many of the readmissions that we're dealing with. So we have embarked on a variety of initiatives, working with both skilled nursing facilities, homeless shelters, federally qualified health centers, to really look at how we can improve access, improve the transitions of care, train individuals in other settings, including caregivers, so that they're more equipped to be able to provide the support and avoid the readmission. But, even the issue of primary care access is a big challenge. And many of our individuals we care for view their primary care physician as the head of our emergency department. They love him. When you ask them if they have a primary care physician, yes, it's Dr. Martin, who's the chair of emergency medicine. So we are working on new models of how do we deliver care more effectively and new partnerships that are going to be incredibly important as we improve and eliminate disparities in healthcare.
So let's, if we can, look internally now. Both of you have embedded cultural competency into your staff training. Talk a little bit about what elements of that really resonate most with staff. What's working?
You know, it's very hard to train everyone on every cultural competence. It's much more important to train them to ask questions, to learn from their patients, because often the patients will be the ones that help them understand what those needs are. You can't know we have more than 60 languages spoken in the city of Detroit. We have a ton of different cultural needs, and to expect every caregiver to understand all of them. So we've been shifting that to more, how do we inquire? Patient inquiry, how do we learn? And then how do we do better in terms of meeting those needs?
Stephen, you too have a very diverse population in New Jersey. 55%.
We do. 55% of the New Jersey population is diverse. In New Brunswick City, more than half the population is Hispanic. And in our county, 25% of the county is Asian Indian, top 10 county in the United States. So there are many, many languages spoken. We've seen the training that we've embedded in orientation, in special nurse competencies, social worker competencies, case managers, in their ongoing annual education. And it causes them to ask the question and to make the recommendations for patient safety. That's when you know that you were effective. And we have specific examples in patient safety, in near misses, where employees using that training that they got, as in Detroit and in New Brunswick, and that training, they stop a problem.
Looking at leadership now, you both also have pretty solid plans to diversify your leadership ranks. I know at Henry Ford you've set percentages where you want candidates for the director level to be either minority or women representation in the candidate pool. And at Robert Wood Johnson, right, you're now 32% minority representation in the leadership ranks. Talk a little bit what that means to the patient and to care delivery. How does that resonate down to diversify your leadership ranks?
Sure. Diversified senior leadership, the administrative staff, department directors. To us, it means new ideas, new ways of thinking, a greater sensitivity to the community. For patients, it's care providers and leaders that may understand their issues better. And that diversity of thought brings us great benefit.
Yeah, diversity is in our DNA. It's who we are and it's who we serve. And it's so important that leaders reflect the communities we're in. And that starts at the board level. It includes senior leaders. It includes our physician leaders. And we've been very intentional. We have a management metric around making sure every candidate pool is diverse. And that has really worked for us. I mean, we have seen tremendous improvement over the years because we've really mandated it. And the same is true in our nominating committees of our boards. If they understand the data of who they're serving, it begins to change their view of who should be on the board.
We had concern early on, Nancy said, about that pool of talent recruiting. Some people were concerned that it might stretch the time, it might slow down the process. We found just the opposite, that we get better talent, that we become a destination now as people see the reputation of hospitals that are diverse and they want to be part of that leadership team.
And I'll give you an example. I mean, I'm a woman leader. And when I came to Henry Ford 17 years ago, we had 2 women in senior leadership. Today we have 16. And it's because we are attracting the best, the very best people. And the same is true of our minority populations. They look at the health system as inclusive and open, and therefore they apply. They don't want to work in a place they're not welcome.
So let's talk about that much further downstream. You both have efforts to reach into the community and the schools to try to attract underrepresented populations into healthcare. what has to happen for minorities, women, to really see healthcare and maybe even healthcare administration as a true career path?
We have several models at Robert Wood Johnson University Hospital of working with the community. Years ago, our city and Board of Education came to the hospital and said, we like what the training you do for junior high school students. We want to put a high school on your campus. And so we partnered with the New Brunswick Board of Education and our city. They run a high school right on our campus. And we have Rutgers, Robert Wood Johnson Medical School, and the management team of Robert Wood Johnson University Hospital. And students are trained, educated right on our campus. I've even taught classes myself on organization structure, so that as they do the project and go into a department, they can draw an organization chart. That really helps us. And today, we have so many high school graduates who went on to college, and now they're nurses at Robert Wood Johnson University Hospital. What great role models for the future.
We have a very similar program called the Early College, and it allows young people at risk, these are 250 at-risk youth who start in 9th grade. They go 1 year post-high school. They get an associate's degree. They get a credential in an allied health profession. And then many of them, as is your case, are going on to nursing school, 4-year degrees. And frankly, they're not real interested in being administrators. You know, they see being doctors and nurses as a lot more glamorous. But they do get exposure, and they have line of sight on jobs. And I think that's really important for young people today. They see the job opportunity, and they talk with people who are in those jobs. And they begin to have a real interest in what's going on.
For many of these students, they're the first one in their family that gets this education. Maybe the first one with a laptop, the first one that goes to college. What a great legacy to start them on that career.
One last question, Stephen, for you. Robert Wood Johnson is in talks, or has concluded talks with Barnabas Health to form some sort of partnership, consolidation, merger. How do you take what you've been doing on equity of care and transfer that across a much larger merged organization?
Sure. Last week, Robert Wood Johnson Health System and the Barnabas Health System announced the signing of a definitive agreement. Both health systems have a long-term commitment to their community. Barnabas Health is active in Newark City, Essex County, and broadly in New Jersey in their communities. That matches the commitment of Robert Wood Johnson Health System to their communities. It will be easy for us to expand the range of our programs, and we look forward to doing that once we receive the state approval.
Great. Nancy, Stephen, I appreciate you taking some time today. Again, congratulations on the award.
Thank you so much.
Thank you very much.
And I'm Matthew Weinstock reporting from the Health Forum AHA Leadership Summit. Thanks for tuning in.